Rule of the opposite hand. While using forceps on elevators to luxate and remove teeth, it is important that the surgeon opposite hand play an active role in the procedure. For the right-handed operator, the left hand has a variety of functions. The left hand is responsible for reflecting the soft tissue of the cheeks, lips, and tongue to provide adequate visualization of the area of surgery. The left hand helps protect other teeth from the forceps should it release suddenly from the tooth socket. The left hand and sometimes arm helps stabilize the patient head during the extraction process. In some situations, greater amounts of force are required to expand heavy alveolar bone. Therefore, the patient's head requires active assistance to be held steady. The opposite hand plays an important role in supporting and stabilizing the jaw when mandibular teeth are being extracted. The opposite hand is often necessary to apply considerable pressure to expand heavy mandible bone, and such forces can cause discomfort and even injury to the TMJ unless a steady hand contracts them. A bite block placed on the contralateral side is also used to help open the jaw in this situation. Finally, the opposite hand supports the alveolar process and provides tactile information to the operator concerning the expansion of the alveolar process during the luxation period. In some situations, it is impossible for the opposite hand to perform all of these functions at the same time, so the surgeon requires an assistant to help with some of these functions. Rule of the assistant during extraction. To achieve a successful outcome in any surgical procedure, it is useful to have a skilled assistant during extraction. The assistant plays a variety of important roles that contribute to making the surgical experience traumatic for the patient. The assistant helps the surgeon visualize and gain access to the operative area by retracting the soft tissue of the cheeks and tongue so that the surgeon can have an obstructed view of the surgical field. Even during a closed extraction, the assistant can retract the soft tissue so that the surgeon can apply the instruments to loosen the soft tissue attachment and adapt the forceps to the tooth in the most effective manner. Another major activity of the assistant is to suction away blood, saliva, and the irrigating solution used during the surgical procedure. This prevents fluids from accumulation and makes proper visualization of the surgical field possible. Suctioning is also important for patient comfort because most patients are unable to tolerate any accumulation of blood or other fluids in their throats. During extraction, the assistant should also help with protecting the teeth of the opposite arch, which is especially important when removing lower posterior teeth. If traction forces are necessary to remove a lower tooth, occasionally the tooth releases suddenly and the forceps strike maxillary teeth and may fracture a tooth cusp. The assistant should hold a suction tip or a finger against maxillary teeth to protect them from an unexpected blow. During the extraction of mandibular teeth, the assistant may play an important role by supporting the mandible during the application of the extraction forces. A surgeon who uses the hand to reflect soft tissue may not be able to support the mandible. If this is the case, the assistant plays an important role in stabilizing the mandible to prevent TMJ discomfort. Most often, the surgeon stabilizes the mandible, which makes this role less important for the assistant. The assistant also provides physiological and emotional support for the patient by helping alleviate patient anxiety during هذا psychological ولا physiological أعتقد psychological هاي The assessment is important in gaining the patient confidence and cooperation by using positive language and physical contact with the patient during the preparation and performance of the surgery. The assistant should avoid making casual, offhand comments that may increase the patient anxiety and lessen their cooperation. While the surgeon holds the surgical handpiece and Minnesota retractor, the assistant provides cooling, irrigation, and suction. Specific techniques for the removal of each tooth. This section describes specific techniques for the removal of each tooth in the mouth after being elevated. In some situations, several teeth are grouped together, the maxillary anterior teeth, because the technique for their removal is essentially the same. The reader should take note of the role of the left hand in each instant. Maxillary teeth. In the correct position for the extraction of maxillary left or anterior teeth, the left index finger of the singer should reflect the lip and cheek tissues while the thumb rests on the palatal alveolar process. In this way, the left hand is able to reflect the soft tissue of the cheek, stabilize the patient's head, support the alveolar process, and provide tactile information to the surgeon regarding the progress of the extraction. When such a position is used during the extraction of the maxillary molar, the surgeon can frequently feel with the left hand the palatal root of the molar becoming free in the alveolar process before filling it with the forceps or the extracting hand. For the right side, the index finger is positioned on the palate with the thumb on the buccal aspect. Incisors. The maxillary incisors teeth are extracted with the upper universal forceps number 150, although other forceps can be used such as the straight forceps. Maxillary incisors generally have conic roots, with the lateral ones being slightly longer and more slender. The lateral incisor is more likely also to have a distal curvature on the apical 1/3 of the root, so this must be checked radiographically before the tooth is extracted. The alveolar bone is thin on the labial side and heavier on the palatal side, which indicate that the major expansion of the alveolar process will be in the labial direction. The initial movement is slow, steady, and firm in the labial direction, which expands the crestal buccal bone. A less vigorous lateral force is then used, followed by a slow, firm rotational force. Rotational movement should be minimized for the lateral incisors, especially if a curvature exists on the tooth. The tooth is delivered in the labial incisal direction with a small amount of tractional force. التراكشن فورس هاي القوة اللي نرفع بيها السن من السوكت مالته. Canines. The maxillary canine is usually the longest tooth in the mouth. The root is oblong in cross section and usually produce a bulge. In cross section and usually produce a bulge called the canine eminence on the anterior surface of the maxilla. The result is that the bone over the labial aspect of the maxillary canine is usually thin. In spite of the thin labial bone, this tooth can be difficult to extract simply because of its long root and large surface area available for periodontal ligament attachments. In addition, it is not uncommon for a segment of labial alveolar bone to fracture from the labial palate and be removed with the tooth. بالرغم إنه اللابيال بون يكون thin, this tooth can be difficult to extract simply لأنه هو long and large surface area available for periodontal ligament attachment. يعني لأنه عنده common periodontal attachment. The upper universal number 150 forceps are the preferred instruments for removing the maxillary canine after elevation. As with all extraction, the initial placement of the peaks of the forceps on the canine tooth should be as far apically as possible. دائما الحركة الأولى apically. The initial movement is apical and then to the buccal aspect لأنه هو الأنحاف with return pressure to the palatal as the bone is expanded. بس احنا قلنا البون وين ممكن ينكسر من يا جهة؟ بالليبيال ينكسر. The initial movement is apical, then the buccal aspect with return pressure on beta. As the bone is expanded and the tooth mobilized, the forceps should be repositioned apically. A small amount of rotational force may be useful in expanding the tooth socket, especially if adjacent teeth are missing or have just been extracted. After the tooth has been well luxated, it is delivered from the socket in a labial incisal direction with labial tractional forces. During the luxation process with the forceps, if the surgeon feels a portion of the labial bone fracturing, the surgeon must make a decision concerning the next step. If the palpation finger indicates that a small amount of bone has fractured free and is attached to the canine tooth, the extraction should continue in the usual manner, with caution taken not to tear the soft tissue. However, if the palpation finger indicates that a large portion of the labial alveolar bite has a fracture, the surgeon should stop the surgical procedure. Usually, the fractured portion of the bone is still attached to periosteum and therefore is viable. يعني ساعتها حية. The surgeon should use a thin periosteal elevator to raise a small amount of mucosa from around the tooth down to the level of the fractured bone. The canine tooth should then be stabilized with the extraction forceps, and the surgeon should attempt to free the fractured bone from the tooth with the periosteal elevator as a lever to separate the bone from the tooth root. If this can be accomplished, the tooth can be removed and the bone is left in place attached to the periosteum. Normal healing should occur. If bone becomes detached from the periosteum during these attempts, it should be removed because it is probably non-vital and may actually prolong wound healing. The same procedure can be used whenever alveolar bone is fractured during extraction. إذا becomes detached from the periosteum during these attempts, the prevention of labial plate fracture is important after elevation and during the luxation process with the forceps. If a normal amount of pressure has not resulted in any movement of the tooth, the surgeon should seriously consider doing an open extraction by reflecting soft tissue flaps and removing a small amount of the bone. The surgeon may be able to remove the stubborn canine tooth without fracturing a large amount of labial bone. By using the open technique, there will be an overall reduction in bone loss and in post-operative healing time. إذا يقول لك لازم كلش نمنع الفراكشر مع labial palate. يقول لك after elevation and during the luxation process with the forceps, if a normal amount of pressure has not resulted in any movement of the tooth, لازم نستعمل طريقة الأوبن.